Welcome to the Rival and Queen podcast. My name's Ashley.
And I'm Sarah.
We're so happy that you are joining us on this beautiful Thursday. Thanks for being here.
All the good vibes, all the Thursday excitement.
I wish you were still singing us into this, Sarah.
I just wanted to sing "Oh Holy Night." I just came to you. I was going to be like, "Oh Holy Night."
Oh, wow. Okay.
I don't sing, guys. So I'm sorry. I promise I won't for any other moment in this episode.
She's channeling all of her holiday songs right now.
I'm channeling all the winter vibes. We got like a freak snowstorm and it was dope.
It's nice, but not ready for it because I drove by Citadel Hill and there's still beautiful green and yellow leaves on the trees. And I still want to enjoy fall.
I don't care. I'm ready for snow.
Her who has a full fur coat on right now because she's freezing.
It is so cold in the studio right now, and I found this vintage fur, guys, at Value Village, and
during our Halloween haul
for $50. Who says no to that?
I don't know, not you.
Do you know what? I'm really happy about it. I'm wearing a floor length coat right now, and I'm warm. So
I'm also admiring your skin right now, Sarah.
Oh, what a week we had. I'm in trouble. I forgot to turn my phone off.
That bad boy.
We went out to Vibe Salon Medi-Spa and we got some skin treatments this week.
Did we ever?
I got the Photorejuve done and you got the microneedling.
We both were prepped by getting the dermaplaning, so kind of cleaning all the vellus hair, all the dead skin, all those things off our face so that the treatments would be able to kind of penetrate deeper into the skin.
Yeah, and I'll be honest, I knew nothing about skin treatments other than a few of them. Like I'd heard of microneedling, I'd heard of like the vampire facial, I'd heard of what else? Dermaplaning probably, but that was kind of it. So this week on the episode, we talked to Kerri Houweling all about skin treatments, but we were lucky enough, Kerri was super generous to do some skin treatments for Ash and I. So we documented the whole thing for you guys.
Yeah, we're going to release that blog hopefully in the next couple of days, which is going to answer further questions you might have after listening to this podcast with Kerri, because it's really an interesting process to see.
Well, so let's talk about it just a little bit, Ash. Like you got the microneedling done. What was it like?
It was very interesting. It was about an hour and a half based on getting the dermaplaning and the prep and then the numbing. So you have to get numbed for 30 minutes. You leave that on your skin. If anyone's had the eyebrow, what's it called?
Microblading.
Microblading, if they've had that done, it's kind of similar. And then she jumps right in and starts putting that needled pen on your face.
I will say though, with the microneedling, I think they use a much stronger numbing cream than microblading.
Yeah, it was really interesting when she started on my forehead. I didn't feel anything. I could feel the pressure, but I couldn't feel kind of the needle. It sounds very much like a tattoo needle, if anyone's familiar with that sound. It started to hurt. It hurt a little. It didn't hurt. I have a high pain threshold, I think, too, but I could feel a bit more in some of the areas around the cheek, which are obviously, there's less fat. It's kind of more sensitive around the bone there. But I'm on day 2. We're on day 2. Well, we're recording on Tuesday. It's Thursday. But I'm starting to flake and it feels a little tight, but I have makeup on, so it looks normal, but it is pretty red.
But it doesn't look normal when she doesn't have makeup on.
We will share. Yeah, we will share this experience to show you exactly. But you're looking good.
Yes, and the only thing I want to say about when you got the microneedling done, even though it wasn't like a pleasant experience, at no point were you like, we have to stop. This is hurtful.
No.
I didn't.
And I felt safe. Kerri knew what she was doing, and she was like pumped at what was happening and getting that
excited
kind of reaction. I think with a bit of the blood drawn is really good. Apparently. You'll hear more about it soon.
And I got the Photorejuvenation done for if anyone has seen me or hasn't seen me, I have like 1,000 freckles. And I'm known for just discovering sunscreen in the past year.
So you're going to
So I had some sun damage to repair. So yeah, I got the Photorejuve and it wasn't So I was worried it was going to hurt, and I'm a bit of a baby with those things sometimes, but it wasn't bad. Like, I think I had set the expectation that it was going to maybe be a little painful, and it wasn't. It was uncomfortable. Like, it's not like a great feeling, but Kerri was super fast, and it wasn't like intolerable at all. I found it good.
Yeah, I can't wait to see it. I think after about a week, we'll have, a better picture of what this could be for us.
My like freckles are just like darkening by the day right now, but they're so funny. I look like I have coffee grinds all over my face, but like not bad. Like I haven't even bothered to put makeup on it, to be honest.
Good. I wouldn't have, but I had a few calls yesterday and Sarah saw what my skin looked like. It was horrifying. I would have scared someone.
She looks like she has a giant hickey on her forehead.
Yeah. Which thank God some mineral makeup covered up. But Kerri was awesome. She has over 20 years experience in laser and all these kind of techniques like the Coolsculpting. There's so many different things that they offer at Vibe. So we were in good hands.
We were in very good hands, and I totally enjoyed the whole process. And a big thank you to Kerri and all the staff at Vibe for helping us out. They were all so lovely and
so great,
so professional.
Yeah,
we love them. Ashley, we had a bit of a fashion show today.
We did, on the sidewalk. Winter's here. We wanted to put them in our new outfits on display. Specifically a jacket.
The fur coat. And then Ashley got these badass combat boots. So we've been walking around Halifax just taking like photo shoots and like...
Yeah, you should check out, if you haven't watched our vlog that we released just last week on YouTube, which we actually kind of dive into our shopping process for these boots. But I finally found a pair.
Yeah, Ashley made a first just like fun video of us introducing ourselves and talking a bit more about Rival and Queen. That's on our YouTube channel. So this is all new for us. So check that out if you want, guys. We would love that. Before we dive into this episode with Kerri, we want to give a big shout out to Luvo for sponsoring this episode. Our absolute favorite canned wine, Nova Scotia made.
Delicious. We are obsessed with the rosé, the Pinot Grigio, and then the
Muscat Mint.
Ooh.
The Muscat Mint's my favorite. Yeah, if you watch our social media, it's our go-to. I'll also say it's my go-to wine right now still, because it comes in, like, the can is perfect. When I'm home,
they're so good
by myself, I don't have to open a whole bottle. I just get the can going.
They're beautiful, colorful. So you've probably seen them at the liquor store. Pick one up, give it a try.
All right, guys, so we're going to dive in to hear from Kerri Houweling now. We're going to learn all about skin treatments, so many, dermaplaning, what do we got, peels, facials, we're doing it all. If you want to follow Kerri, you can at Vibe Salon Medi-Spa on Instagram and Kerri_Vibe Medi-Spa. And we'll have those both in the show notes for you.
All right, let's do it. Kerri, we're so happy that you are back with us. This is your second time, so welcome back.
Thank you.
And the last time you were here, I don't even remember when it was, but it was with Nurse Andrea.
I want to say, I think it was February-ish.
Right.
It was
early
like just
last year.
Pretty much not too far before the lockdown happened. So yeah.
Awesome. Well, we're happy to have you back because we had so many people that loved that episode with you guys, and we tried to cover skin treatments, so much Botox, injections.
There's a lot of content.
So much content. But now we're able to kind of focus on what you do and more on the skin treatments side, because Sarah and I are super into this right now, especially with winter coming.
You're here by popular demand.
Thank you. Well, I'm excited to be here. I love to share knowledge and especially around skincare. There's a lot of different facets and different treatments out there. So if we can demystify them a little bit, that'd be great.
Well, and I want to thank you too, Kerri, because ever since you were on our podcast in February, I've now started wearing sunscreen on a regular basis. Excellent. And I was getting breakouts at that time, and they've all gone away.
Oh, really? Amazing.
Yeah, because I followed the skin routine that Kerri recommended. So you have helped to change my life in the last 6 months, and thank you.
You're welcome.
That's good to hear. But you're right there. It's hard to actually know what to listen to, what to buy, because there's YouTube, Instagram, all these different Sephora, all these different reviews and things coming.
Lots of influencers, and that's a great thing. but it's true. There's so many things coming at you from every different direction, whether it's a product line, the newest fancy ingredient on the market, treatments available. How do you know what to choose? Where do you want to spend your money, and what results are you looking for? So there's a lot to look at. Yeah.
Especially as women, I feel like we're just more into it than some men. Some men are into it.
Yeah.
But this is why we got Kerri here, because she is the queen of information for us in teaching.
Yes. But the first question I have for you, and that I know Sarah and I have heard a bit from friends and people that have written us, is the maskne situation. For those of you who don't know what that is, it's from breaking out from your mask, essentially.
Absolutely.
Because here in Nova Scotia, we have to wear them inside pretty much everywhere.
Yeah. I mean, I have to be honest, I'm an acne prone person because I'm an oilier skin, and knock on wood, I've been great. And others who've never experienced acne before are finding that they're developing acne because they're wearing the mask. A few things. I actually did an interview during the lockdown about what's going to happen when we all go back to work and wear our masks all the time. And, the hard and fast rule, to be honest, is don't wear makeup under your mask unless it's a mineral type of makeup that has an antimicrobial property to it, meaning that it will help to combat bacteria. So product line, I work on one called Jane Iredale. It's very popular. It's not the only mineral line out there, but it's a very pure one, and I know the quality. So using something like that, washing your face as soon as your mask comes off, so important, with a good gel type cleanser, and using a toner as well to moisturize the skin. The other thing I can recommend as far as the mask goes is, don't wear the makeup, but also don't layer heavy amounts of product, anything like heavy moisturizers, things like that. You want a very clean environment because it's very humid in there. You're breathing in your mask.
Right.
So lightweight moisturizers, serums are beautiful. No makeup unless it's mineral, and wash your face as soon as that mask comes off.
These are very good tips.
And you know what? I've been trying to do that because I thought, why am I wearing when I'm in public? Like if I'm in a store or other places, why am I putting makeup in an area that no one can see? But I do anyway. It's just like a habit to keep going.
It is, and I see it all the time. People are coming in, and I'm not saying to avoid makeup, but if you have to have your mask on for any certain period of time, just picture what's going on underneath that. You're breathing. There's no real air quality, like good air quality coming in, and then that environment is just prime for bacteria. So you just have to be very careful.
Oh, those are such good tips.
And I'm assuming wash your mask a lot.
Yes, definitely. And have a few in your purse. I switch my mask out at least twice a day. Because in the treatment room, we're definitely masked from before we even enter the building until I leave. And I work 10, 12-hour shifts at times. So I'm always switching my mask out midday and then take it off for a while. Get into a private space and get a breather. As long as you're not around people, go in your room and take it off for a little bit. Another good tip is you can keep those skin wipes in your purse. If you are someone who really struggles with breaking out, little cleanse midday is not a bad idea either.
I love that. These are fantastic tips. What I hope comes from this is that Ashley only puts makeup on half her face, and then I see her when she takes her mask off.
Okay, I don't wear that much makeup.
I know, but I just think it would be funny. No, you don't.
And I have been wearing usually just my Jane pressed powder.
And that's actually totally great under the mask.
Okay.
Because it has that antimicrobial benefit to it, and you won't get any problems wearing that. It's very lightweight. It's actually totally breathable. Like that makeup will not congest your skin, so you're fine to wear that if you have to. I don't even do that as a skin therapist. I'm all about just my healthy skin right now, treating it at night, making sure it has all the nutrients it needs so that it's then going into the mask, it's in the best state it can be. So I'm just not wearing foundation. It's all about the eyes, concealer, brows, eyeshadow.
No lipstick.
Yeah. And then of course sunscreen, because I always used to get my SPF when in the winter time through my foundation, through Jane Iredale.
Yes.
However, now I'm wearing a different type of foundation. It's like a white tea SPF, like a moisturizing, hydrating lotion that doesn't leave a film on my skin, isn't heavy, because I just don't want to wear any makeup under my mask.
Yeah, we love that. So one of the reasons that we wanted to get you, or the biggest reason we wanted to get you on today, Kerri, was to talk about skin treatments.
Yes.
Something that is such a mystery.
Yeah.
To me, less of Ashley knows a little.
Mm-hmm.
Yeah, and so everything, like things like dermaplaning and microneedling, and you guys do Coolsculpting. I don't know what any of these words mean.
You're not getting Coolsculpting on your face.
Photorejuvenation. We do
Photorejuvenation.
You do for submental fat, so chin fat. But as far as skin treatment, no, it's not considered that. But yeah, there's lots of great skin treatments out there today. It's just knowing which one is for you.
Well, and that's why we've got you here.
Yeah.
So there's so much information and so much to cover. I guess one of the places that maybe makes sense to start are like, what are some of the reasons that people get skin treatments?
So typically when people come in, they're concerned about something happening with their skin, whether it be an aging concern, hyperpigmentation, some people developing rosacea, that's that redness to the skin, broken capillaries, lots of sun damage, acne is a big one as well. So, and then others just want to really take care of their skin. So they don't have any specific issues, but they know that as they get older, those issues will arise. So they want to prevent them. So those are the two main, I guess, clientele that I see coming in, but mostly people who have a concern. They're coming in to address a specific concern.
And do you sometimes disagree with what their concern is? Like you would recommend different treatment based on kind of what you see in their skin?
So I have two mindsets there. Sometimes people come in thinking they want a certain type of treatment because let's face it, online, you can Google, research anything and learn. However, doesn't mean that's appropriate for you. So let's just say if you come in saying like, I want microneedling, and then I'm like, well, here's what I'm assessing. That's not really going to give you the result you're looking for. This is what will. So it's just about education. Right. The other thing is that when it comes to the skin, you just have to listen. And I never, ever, unless asked, like if someone says like truly assess my skin and I will let them know what I see, but I will always, always want to make sure that I address the concern that they have. Right. Other things will get addressed with that, but that's my priority.
Oh, I love that. One of the things that I know for me even, and when I talk to some of my friends, we're aware of skin treatments, like I'm aware they exist, but like I have no idea where to start.
Yeah.
So how can we figure out where to start?
You start by coming and talking to a very experienced skin therapist who will address any concerns that you have, analyze your skin, ask you questions, take your health history, make sure that, what's underlying. So we really want to figure out what is going on and then develop a treatment plan. I like to work in partnership with my clients. There is no race. It's not like it doesn't have to be a one and done. I like a long-term relationship because that's where the best outcomes are. It's what you do at home that's going to make the most difference, to be honest. So every day at home, using your good product, and then putting in the skin treatment protocols with that. It might start off as many in the beginning and then peter down to maintenance, but it really does depend on what we're addressing. But yeah, it's just developing a relationship, getting the good advice, getting someone to analyze your skin.
So we can come in and get like a consult.
Oh, absolutely. Yeah. That's the first step if you're not sure, is get the right advice.
And then just have the conversation about what your concerns are, what you guys offer or whoever you're seeing offers, and then kind of like figure out how to move forward.
Oh, 100%. And it comes down to many different things. What is the lifestyle? Do you have time to have some downtime? Because some of these treatments will give you some downtime. So what is your lifestyle like? What's your work life like? What financial budget do you have? Like I want to know all of those things, and then I can fit you into the right place or get you there eventually. It just needs that initial conversation. We also scan the skin. So we have a skin scanner. So I can see what I see on the outside, but our scanner can see what's happening inside. And that's awesome. You guys will get scammed next week.
I haven't had that. I've been looked at under the woods lamp, which I think is a bit scary.
This is a super fancy woods lamp. It takes about 6 to 8 images and reads many things from the metabolic function in your skin. What's the underlying UV damage that you can't see? How much congestion is there? Even if we can't see it physically on the surface, it's there and it'll show us. So,
that is so helpful. So Sarah and I are actually going to see Kerri next week.
Yes. Getting some treatment.
Yeah. We're gonna get some treatment.
I'm going to be getting the microneedling.
You're getting needling, yes.
And Sarah was getting
Photorejuvenation.
Amazing.
Both are my, like, honestly, the best treatments you can ever invest in for your skin would be those two. Those are my top two.
Okay.
They go down the list for me, but those two are at the top. And the two combined, depending on your skin concerns, is like dramatic changes to the skin occur.
So let's kind of talk about those two, because we are going to be sharing our intimate experience getting these treatments done.
Mm-hmm.
So what would someone be kind of benefiting from getting the microneedling if they came in?
Microneedling is also known as collagen induction therapy. So what it's doing is creating tiny little wounds in the skin. When our skin is wounded, we go into a wound response. And what happens is we produce new collagen. So it's fantastic for someone who wants to keep their collagen healthy. I hate to tell you guys, but in your 20s, we start losing collagen every year. And by the time
we're in our 30s.
Yeah. I'm almost 50. I'll be 50 next year.
Yeah, but that's not real.
So we keep drinking our
you've
beds.
been frozen for like a decade or two here.
But you have to understand you are losing collagen. That's just natural aging process.
Right.
Lifestyle influences that greatly as well. So you need to do what you can to keep your collagen healthy in the skin, and that's the constituent in the skin that makes it plump and toned and tight. So that's really important to maintain. So that's what microneedling does. We basically are reformatting the skin with these tiny little wounds, new collagen, fresh, beautiful, bright, even toned skin. It's awesome. It's one of my favorites.
I love that. This is so neat. And so what's the downtime with that? Is there any downtime?
There is some downtime, yeah.
Okay.
Well, there's downtime with me. I'll be honest with you. I like to do, it's not aggressive. I'm not an aggressive skin therapist, but I like to treat with intensity.
Okay.
If that's something your skin can handle, because the outcome is much better, in my opinion. So very safe. I've been microneedling the skin for about 15 years. So I have a lot of experience with it. That's important to find an experienced person as well, so they're comfortable with those needles. And yeah, redness, some flaking, because as we're wounding the skin, your skin is detecting that wound, that damage. It's going to slough off and new skin will follow. Not the same as a peel. Peels, like you can actually really shed a lot of skin with a peel, but visible flaking, particularly around the mouth, I find, and forehead is pretty. Cheeks don't peel too much or flake too much.
So when someone comes in, you're saying that you would either go kind of less intense or more intense. How do you kind of gauge that? Is it something you just start doing and you're able to see the reaction in the skin?
So if you're a candidate, so I would first and foremost look at that. So what's the candidacy? You can have no blood disorders whatsoever. You know, you can't have uncontrolled diabetes, autoimmune disorders. You have to have a healthy immune system to have microneedling, because it's your immune system that's doing the work. I'm creating little wounds. Your immune system does the work after that. Okay. The other thing is the skin thickness. Is there any scarring that we need to address? Maybe some acne scarring that might be there. That different areas of the face. So the forehead, my needle depth would be less than my needle depth on the cheeks. We typically work between 0.5 and 1 millimeter into the skin.
So is this like one needle at a time?
No,
there's a bunch.
I use a pen, and in my pen we have 12 tiny little needles. It resembles almost a tattoo sound, like it's going in and out of the skin very, very fast. So thousands and thousands of tiny little wounds every second are going into your skin. And I treat the skin very evenly, and I make sure I spend a lot of time on your main areas of concern, or if I see an area that has more skin laxity or some acne scarring, or you just really want to tighten tone, I'm going to spend extra time there just to give you the better.
Does it help? I'm like, I can't even wait for you to finish because I'm excited. Does it help with scarring and like pigmentation?
Yes, it does. It helps with everything. Pigmentation. If you came in to see me with just a concern of pigmentation, I likely might steer you in a different direction depending on the type of pigmentation you have. Although microneedling will address that. The needles will kind of puncture through that pigment, and your skin's immune system will then clear that away. But there are better ways to address pigmentation, so it's not my go-to. But it's amazing for scarring, skin rejuvenation, just keeping that collagen healthy. If you had pigment, I'd probably partner in the Photorejuve with that. as long as it's not hormonal. So sometimes we need to do a couple of different treatments to give you the best outcome.
I love that. Well, that brings up a good point, is it's not necessarily just a one and done,
No.
right? Like, you recommend treatment plans.
Yes. I'm not a therapist that does the one and done, to be
Okay.
honest with you. Like I'm just not, that's not what I like to do. I like to develop a partnership with you. So, and not to, you just can't get the results in one treatment. You can't go to the gym and lose 20 pounds because you worked out once.
Right.
It's the same thing when you look at the skin. Like, what level of issue are we talking about here?
Right.
Are you someone who's just noticing signs of aging and you're like, I gotta get on this, I want to prevent? Prevention is easy.
Okay.
But correction, that requires more treatments, more financial investment,
Right.
more time on your end to come in and address those. Because if you let something get too far, it's no different. I equate it to weight loss all the time. Or if you've gained a lot of weight, you're going to have to spend a lot more time in the gym, really focusing on that.
And
It's the same,
change.
yeah, depending on when you come to see me, how long has it been an issue?
Okay.
I think we're in the prevention stage.
You guys are totally in the prevention stage.
I'm getting the Photorejuvenation, so I don't know if I followed that stage, but we'll find out.
But even
Me
I've
too.
gone to Vibe for many, many years now, and I felt like some things I would be addressing specifically, like acne or just getting a facial, but I knew even some of the treatments I would get done, like peeling and peels and things. I'm like, this is going to be a long-term gain.
Yeah. And ladies, I'm not at all saying you need to, or anyone has to be in our clinic every week. Like, no.
Yeah.
But when you're starting a program, typically like microneedling, we always recommend a series of 5 treatments, 6 treatments if we are dealing with some scarring. Just takes that many times to get there, and usually we space them about 4 to 6 weeks apart. So it takes time to get to that end, and then the result keeps improving even after your treatments are done. The same with photorejuvenation. It's a series of 5 with me. It's once every 3 to 5 weeks. And then after that, maintenance ensues. But as long as you like have those treatments done, use your proper home care, keep that sunscreen on, then the maintenance is easy. If you stop doing everything a few years later, you might need another series. But it's kind of like, again, bringing it back to weight loss. If you lose 20 pounds and just keep those healthy habits, that weight's not coming back on. It's the same with rejuvenating the skin. Once we get you to a place, you can maintain it with home care, sunscreen, and just maintenance visits to see me.
Oh, I love that.
And I'm assuming it isn't painless because there are needles going.
Give us the pain level.
There's many. I numb you
talk
for
about that.
30 minutes. So I always do a full dermaplaning of the skin first. So I want to remove the vellus hair and that surface dead skin. Then the numbing cream goes on. 30 minutes, you really won't feel anything. If you don't numb enough, yeah, it's not the most fun treatment to have, but I make sure I numb you very well.
And I just want to ask one more question about that. So you mentioned you can't have blood disorders or autoimmune.
Yeah, you can't have any issues with blood clotting. Like, we're creating, you will bleed in this treatment. That's what I'm looking
You're
to
gonna
have
watch
happen.
this.
Documented.
And so is everyone else.
So pinpoint bleeding is when I know that wound response is going to happen. Okay, it's starting that cascade of that wound response. That collagen will build in.
So bleeding is good.
Bleeding is what you want to have. Yeah. I mean, you know, you will find some companies say you just need to see a little bit of pinpoint bleeding. I find with needling, like, you really want to see bleeding.
Okay.
You get a really good result. And then you're addressing your own growth factors are happening. You're starting all these great.
They look new. No one's going to recognize me.
I know. You don't leave like that though.
No. I feel like from what I've seen on YouTube and stuff, you just look a little sunburnt.
You do, yes. And but nothing mineral makeup won't hide, so you're fine. And listen, downtime's the best time. We all wearing masks anyway, right? So
now is the time.
And so can you be breastfeeding, pregnant, on any type of medications, things like that? Who can't?
So for microneedling, it really is mainly, you'd have to have the right skin type. So if somebody came in with very thin skin, I knew wouldn't heal well, that's not someone I would microneedle. Again, blood disorders like diabetes are especially uncontrolled. Yeah. And certain medications, of course, if you're on blood thinners, like, we're not going to do anything to wound you if you're on any sort of that medication or have any issues with your immune system. So it's something that we discussed prior to. Breastfeeding, yeah, I wouldn't have a problem needling. I mean, it's just wounding, but I would avoid using certain ingredients in your treatments if I knew you were breastfeeding. If you're pregnant, no, definitely not. Okay. We don't do anything with intensity on anyone who's pregnant.
Lots of mom friends and breastfeeding friends. These are questions.
But breastfeeding, I would microneedle. Some people might disagree with me, but there's nothing in that as long as I avoid using certain skincare ingredients.
Right. Like retinols.
Yeah, retinols. I wouldn't do that while you're breastfeeding, particularly, especially, you know, good quality pharmaceutical strength. No, but the needling it's literally natural. It's a natural process. So yeah, I would have no issue.
Amazing. Mm-hmm. So let's dive into the Photorejuvenation. What is that one?
So Photorejuvenation, we're using the machine that I have is called a broadband light. You would also heard of intense pulse light. They're both the same thing. It's laser-like technology, but it's different than a laser. Not to get into laser science. Lasers target different colors in the skin as well as treating for hair, so hair removal. Lasers come in specific wavelengths. So depending on the laser you have, LED or BBL, we can use many different types of filters of light or wavelengths of light in this one little parcel of machine, which I find very amazing because I can treat so many different things.
Wow.
So with Photorejuve, we're targeting two things, red and brown. That's it.
Okay.
Those are what my lights see. That's what my filters see. So if you have a tan, you can't have it because this light loves color.
I do not have a tan right now.
No, you don't. I wouldn't do it if you did. The nice thing about Photorejuvenation is the light will seek out and really even out the skin tone. So it's going to get rid of age spots, sunspots, broken capillaries. There's nothing else that will do that. So only lasers and light. So if you have a lot of broken vessels, you're not going to get treated with creams, peels. There's nothing else. Microneedling maybe, but this is the gold standard for treating like broken vessels. And a lot of women in Nova Scotia and men have that. There's a lot of fair skin tones around here, very prone to broken capillaries and broken vessels in their face. So it's great for that.
No, I don't.
I have one.
Oh, really? I've never seen
and Tanya's tried to get it
worse,
before, and it's like really hard to. It's like right here under my nose. And like
just
the
have
weird
to zap
spot.
it. Yeah. It doesn't feel great. I can't numb you.
Oh, this
No.
I'm getting the heads up.
Yeah,
okay,
you're getting the heads up. A lot of my
Can she drink wine before or after?
Actually, she can have a glass of wine because it will dilate her capillaries, and those would be better targets for me.
Perfect.
Yeah.
All right.
We'll have one of these.
I'll be having a Luvo before I get my skin treatment. So the Photorejuve, I'm very excited because I do have very freckly skin.
Mm-hmm.
But then also, as we found out the first time we had you on, I was never wearing sunscreen properly for my entire life.
Did you do the face scanner on her?
Not yet. That's both of you next week.
Oh yeah, this will be funny. But I have noticed in the past couple of years, and I think you mentioned this too, like it's like where a couple of my freckles have started connecting.
That's what I'm finding is what I saw when you came in for the consult.
Yes.
And that's what people have to understand is, you know, I do have clients that will come in and say I wear sunscreen religiously and I've been wearing it for many years. I'm like, yes, but unfortunately, a lot of the damage that starts coming out in your 40s and 50s happened before you were 18. You didn't wear sunscreen then.
Right.
This is damage caused many, many, many years ago that start coming out in the later years. So this is amazing for that.
Okay.
Yeah.
I can't wait.
So you'll get brighter, more radiant skin. It doesn't tickle. It does feel like like little tiny hot snaps on your skin, but it's not a long treatment, so it's not something you have to endure for a long time.
I felt like it was someone was like hitting my face with a little
elastic band. Yeah, that's it, like little snaps.
Yeah.
Mm-hmm.
It was. Listen, we'll see how it goes. I can't wait.
And Photorejuvenation is you have to really ask the questions when you go to a clinic to seek out this treatment. Make sure you know where were they trained. There's no licensing for laser technicians in Canada. You do not need to hold a license to perform laser or light-based therapies.
That's terrifying.
You need a license in Atlantic, Canada to do makeup and manicures. But you lasers. Do not leave, no, because there's nobody that's taking, that wants to oversee.
Right.
Yeah.
That's interesting because my friend got burnt years ago, like severely, had to go to the hospital. Her armpits from getting laser hair removal.
Yeah.
it was like a sale online, one of those kind of Groupon things.
I tell you to avoid it.
Idea.
There's certain things that you don't look for the deal with. Photorejuvenation or light-based therapies using heat, not something you want to shop around for a deal. You want to know who's doing it, what experience do they have. I typically recommend clinics that work with physicians, and just ask the questions.
Okay.
Because you don't need to even be an esthetician.
Crazy.
I could train.
Like
you
I
literally,
could become.
yes,
Oh,
you could.
This is my dream come true, though. If I could figure this out. I love skincare.
Okay, yeah, I would trust you, but no one trusts
I
me.
wouldn't. No.
But you need to ask it. Luckily, a lot of places are reputable, but I just always caution people, because I've had people come to me who've been to places and they didn't have a great outcome. But I assure you, in the right hands, it's a beautiful treatment.
I can't wait. And what's the downtime or the experience after we get this done?
So the first time for you and most people having photorejuvenation, you're going to notice a lot of dark pigmentation, because what this is treating is what it's on the surface that you and I see right now. Because this light is so smart that once it sees brown or red, it's going after it. That's why we don't treat a tan, because it's so surface, so superficial. Right, okay. So all that light energy is going right in the top. Okay. So you're going to know, it's almost going to look like you have little coffee grinds on your skin. People are going to think that you have dirt on your face, and then it'll just flake off in about a week.
I can't wait.
But it's really awesome.
I think it's going to be hilarious because I have so many freckles.
You're going to be very, it's called lit up. So I would call your face lit up. Your pigment right after I'm done will be dark, but by the next day, it's like a Polaroid developing. It's going to be really dark the next day.
There's some spots, because I've had it done by Tanya, and there's some spots that get like, I remember there was a random, you don't even know you have a freckle there, like the tip of my nose, and it was like black.
Yeah. So that's just the first
tiny.
time. The first treatment that gets the most superficial pigment, that's when the downtime is the worst.
Okay.
Then when you come back, that's gone. So the light gets deeper. It will pull pigment out, because pigment can be layered throughout the skin. Okay. Layers of the skin. That's what the light is doing. But your immune system is also clearing that away for inside. So it's working both from sloughing off the surface as well as removing it by your immune system within the skin. So the first time's the worst, but then after that it gets easy. And you can wear makeup
and cover it.
Yeah.
Easy. I can't wait. And everyone listening, I'll have lots of photos for you. So
yes.
Look forward
I love
to
it. Yeah.
Before and after.
Yes.
I love that. It's just like going to be a fresh face.
The other treatment that you mentioned, Kerri, was dermaplaning.
Mm-hmm.
And what is that? Because Ash just had that done.
I've had it several times. You've done it on me before, but so long ago.
It was, yes. I've been performing dermaplaning in Nova Scotia for probably 15, 16 years. I did my medical certification, medical aesthetic training in Atlanta, and it's huge in the States. So I was very fortunate to learn that a long time ago. Brought it back to Canada. I think I was the only one. I might have been the only one in Canada to do that for a few years, because just nobody was training it here. Then I started to train someplace. Now it's everywhere, and it's a fantastic treatment. You actually use a surgical scalpel blade to do this treatment on a 45-degree angle, and it's removed on taut skin, very experienced hands, and you're removing that superfluous vellus hair as well as layers of dead skin. We can remove more microns of skin with dermaplaning than I can even do with microdermabrasion. And we're getting rid of the vellus hair, which really serves no purpose.
Okay.
Yeah.
And the misconception I think people have is that your hair is it grows back the exact same. And
it
all of a sudden
is,
it's just back one day.
It is a total myth that by removing hair from the surface, superfluous vellus hair, that you can stimulate that hair to become what's called a terminal hair. So terminal hair is what we have on our head, underarms. Some women, through hormonal changes, will develop beard-like or terminal hair on their face. And if that's present, I will address that prior to doing dermaplaning. We can do laser hair removal on that, or let them know that we can remove it with the blade. It'll come back as it always did. But you cannot influence the root of the hair by removing it on the surface.
Oh, that's
impossible.
That's a good myth bust.
So it's only your hormones. Like hormones regulate hair growth. That's it. Nothing that I could do.
Yeah, sometimes I notice there would be like a few little like prickly ones, kind of just like around your hairline. Other than that, it's like smooth as like your palm of your hand.
As a baby spot.
When you start, you don't stop having dermaplaning, because everything, if you think about it, and some people have more superfluous hair on their face than others. Some people just have that lot of peach fuzz.
Yeah.
if you're investing in good quality skincare and you're putting that on top of that peach fuzz, I can guarantee you're getting a lot less efficacy. It's not penetrating because it's got to get through that layer of hair.
Right.
So by removing that, you're really creating an amazing environment for your active ingredients to actually work, as well as your makeup looks amazing. Your skin is glowing. It just looks, it's a beautiful treatment.
And it's not super expensive either.
No, I mean, I charge $72 for a dermaplaning treatment.
Okay.
It's not expensive.
And that was one of my other questions, is like, what are the reasons that people get dermaplaning? So you're saying for makeup and for like, for.
So someone who's got a concern with a lot of peach fuzz on their face, it's really not safe to wax that. I mean, I will oftentimes partner a lip wax with dermaplaning, only because many times the hair on the lip is more of a more coarse. It is right. Terminal hair. I don't love using my blade for that, so I'll do a quick little lip wax and then I'll dermaplane the rest. Because they see the hair. Have you ever been driving in the car and you're looking in the rearview mirror and you like notice all of this peach fuzz, especially in the summer?
Yeah.
Women who are going through menopause, they get a lot of superfluous hair. Okay. So they just want, just more even, clean, radiant skin.
I love that.
And any age, can you have it?
Any age, honestly. I've treated girls who are, I would say about 16, to be honest with you. You'd have to, with parental consent, that's about the age that I would start. Not that I have a lot of 16-year-olds coming in, but I think at that age, you can make an informed choice as long as your parents are aware. Because for a girl, imagine if she's got some superfluous hair is dark. Right. Like on my sideburns, because I'm a brunette, dark eyes, and I'm a skin type 3, my sideburn area, it's soft and superfluous, but it's not white.
Right.
And I don't want to wax it. So I do have some teenagers that come in and just a little self-conscious about that.
That's a great point.
So, and I just want to ask this question as well, because you can buy, say at Sephora, the drugstore, the little blades, people may use them for their brows and things. Yeah. Should people not be using those at home on their faces?
So that would be called shaving. Okay. Is very different than dermaplaning. Gotcha. So I do get my bee in a bonnet a little bit when I go to Winners and I see these dermaplaning. They're called dermaplaning blades. It's not. Dermaplaning is more about the professional exfoliation with a surgical scalpel. That is a very sharp blade. Yeah. I guarantee you that what you're buying at Winners or on Amazon is not the same. What you're buying is a razor when you're buying those. Okay, you will remove the hair, so will my scalpel. But the more important piece that you're not getting is that deep professional exfoliation.
Okay, and so it's the exfoliation that's the big difference.
Should see the dead skin that lifts off. It's unbelievable. Yeah,
we'll get right in there.
So that's not a dermaplaning. Okay, they're calling it that because that's the buzzword now. But true dermaplaning is in a clinic with a surgical scalpel.
Okay, and how often would you get that done?
I always pre-book everyone for on the 4 to 6 weeks. Depends. Okay. After 6, you're ready. It's all back. So
okay.
So in all these treatments, especially the Photorejuve and the Microneedling, what can people do in advance to prepare? And you're talking about immune systems. Is there things like we need to do internally and physically to prep?
So during the consultation process, I'm always going to address your home care routine. And as I said, I ensured that you guys were on the right ingredients.
You did. Yeah. Kerri gave us some lovely gifts to make sure we were ready.
So let's look at the microneedling, for instance. So I know that when I do your microneedling, I want adequate stores of vitamin C in your skin, topically applied to the face. Vitamin C, you need to have it in order to produce abundant collagen. If without it, you wouldn't get the best result. So that's really important and something you should use forever. Now keep in mind, not all vitamin C is created equally. So just because you see vitamin C on a bottle of cream, and again, I'm going to say Winners because I hear a lot of people come in saying they buy stuff at Winners. You don't know what grade vitamin C you're getting. There's food grade. There's what I would use, which is an L-ascorbic acid USP, which stands for United States Pharmacopoeia. It means it's intense, bioavailable, and it will penetrate. Food grade, not so much.
Right.
And if you buy a vitamin C product and you see if it has a smell or if it looks brown in any way, it has oxidized, and do not use it. That will create oxidative stress in your skin, which can actually do harm, not help. So be very careful with your vitamin C's.
Yeah, you reminded us that when you gave us the Vivian one to keep the tops tight.
Keep the tops tight.
And this is the first time I've used vitamin C. This is like another skin confession of mine. And I love it.
It's beautiful.
It's making my skin like super radiant
and glowy. I was just gonna say it's and that happens after even the first week.
Well, I went in to see Ashley. My sister did our makeup a few weeks ago, and I had just done all of basically my moisturizing.
Yeah.
And you both were like, your skin looks so glowing.
Yeah. So vitamin C is considered a hero ingredient for the skin. It just means that for your skin to basically be healthy and to produce collagen, you have to have this vitamin. Yes, it's important to supplement internally, but honestly, that intensity applied directly to the face where I'm doing your treatment, that's what we need. If you just take a vitamin C supplement, or if you're really great to eat your oranges, amazing, your body needs that. But very, very little of that's going to go directly to the skin on your face. So you have to use a topical to prep for these treatments. So I always recommend a couple of weeks at least using them just to get you ready. So you'll heal properly and you'll get the best outcome.
We love that. Can we talk about microdermabrasions? Because you brought that up.
Yes.
I don't know what that is.
So microdermabrasion has been around a long time. Originally, well, there's a couple of different types. You can get a microdermabrasion that has corundum crystals, which is like sand or almost like a diamond type of a crystal. And it literally, it's a spray and you run the tube over the face and it sprays the crystals and then it sucks up the dead skin that the spray of crystals is lifting off.
Okay.
So you make passes over the skin. I use one at Vibe now with our Bella ND treatment, and it's a diamond dermabrasion. So it's a diamond tip. It's a very rough tip. It's not spraying anything at you, but I run it over the skin and it basically lifts and removes the dead skin, and then that's suctioned out.
So is this like a deeper version of the dermaplaning? Like, is it going deeper?
No, I can remove the same amount of skin. It's just a different way of exfoliation. So if you were someone that said, Kerri, there's no way I want dermaplaning. I just don't want, I like my vellus hair. Okay, great. I won't do that because I can't do it without removing that.
Yeah.
And it isn't everyone's comfort level. And I know that. So this is just another professional way of exfoliating the skin. Peels are the same. Okay. A lot of treatments do the same thing.
Okay.
That's the one thing to mention.
Just like preference.
I didn't know that.
Preference. They do the same thing.
So that brings me to wondering what IPL is, because I get confused of Photorejuvenation and IPL. Are they the same?
They are the same thing. So I'll demystify that a bit. So intense pulse light is capable of doing multiple different treatments. Photorejuvenation to treat pigmentation and broken vessels. Hair removal because it loves brown. So the darker the hair, it's going to treat the hair. IPL also has filters of light. Again, it's different filters of light. So a shorter filter of light I can use to treat acne because it will kill the bacteria. Hair removal gets a bit deeper, photorejuvenation, and even up to skin tightening, which is in the 800 nanometer range. It's all different wavelengths of light. They each target something different. So intense pulse light is the machine, and the different treatments depends on what light filter I use.
Okay, that makes sense.
Yeah,
good to know.
What is the treatment if you have concerns with acne that you would recommend?
It does depend on so many things. It depends on what type of acne. So are we dealing just with blackheads and some mild acne? Because there's different grades of acne.
Right.
As a clinical skin therapist, I can only really treat acne grade 1, 2, and 3. If it's anything worse, grade 4. If it's affecting the face, the shoulders, the back, the chest, you really need you need medication. So whether it be topical or an oral antibiotic. But for the most part, acne can be dealt with the correct home care. Okay. People who have acne, unfortunately, it's such a hard thing to go through. I've been through it myself in my early 20s. And people with acne are notorious from skipping from brand to brand to brand to brand because they're so frustrated and they don't think anything works. But it requires a lot of patience because it's not going to work overnight. There's a lot going on that we have to address. So getting rid of the congestion, so extractions, calming the skin, anti-inflammatory, treatments. Salicylic acid, you were mentioning, use that. That's great
good for me.
No, it isn't. You shouldn't be using that.
I just I saw it, and I don't know. This lady that uses it on Instagram doesn't have acne, but I think I got insta-sold on that.
No.
And another misconception, or maybe this is true or false, that people with more acne-prone skin are kind of hesitant to use any type of serum, oils, things like that, but it actually is beneficial, right?
Depending on, so oil loves oil, right? So if you have, if you're trying to deliver an ingredient into the skin and you have an oily skin, if it comes in a carrier with a bit of oil, it will work well. It doesn't mean that it's congesting or comedogenic. So that's what you have to rely.
Okay.
The more important thing is oily acne skin tends to be chronically dehydrated because they're using products, different lines all the time, and it's really stripping away their natural moisture factor, which is the water content in the skin. So you have to use hydrating lotions and serums, not heavy, not oily, but you have to hydrate, because if you don't hydrate, your skin will actually try to compensate by producing more oil. So you're just backfiring on yourself.
Oh, that's good.
So yeah, hydration, that's the key. Water binding. Hyaluronic acid is like someone with acne best friend. Salicylic acid, it's an anti-inflammatory. It will calm an acne lesion. It's a great exfoliant.
Could you use it just as like a
spot?
Maybe that's what I should do because of the mask. I just need
because the maskne.
The maskne's got me.
So you can use sal acid anywhere that you're experiencing breakouts. And I say that to people, if you're using acne product, it doesn't mean you need to use it all over your face. Like, where are you actually breaking out? Because you might have to zone treat. So if you only break out on your forehead, only use your acne products there.
Right.
It tends to be a little bit too much if it's on an area that doesn't have an issue.
What we should do when we go to Vibe is actually kind of go through some of the products and share them with people too, because I think people are intimidated sometimes by like products. And
acne is I have a passion to help people who have acne, and it's a less is more mentality for me. So I'll usually take things away from people who are using XYZ. It's a good cleanser. Very, very important to cleanse the skin. A nice hydrating toner, not too astringent. You're not looking to strip the skin, but make sure your skin is very well cleansed. And then using hyaluronic based serums and a nice lightweight hydrating moisturizer, maybe a blemish, some benzoyl if you have a little blemish, a spot treatment, but really that's it. And your exfoliating agents can typically be with like a salicylic acid is an amazing way to exfoliate acne skin. So it's less is more. So again, I usually take things away from you and then we'll slowly add things back in.
On that note, like I just have to add that meeting you has been game changing for me and for my skin. And what I really, really love about what you do and what Vibe does, like you're very genuine in this. You do like to work with people and help educate them on how they can take care of their own unique skin. And I think that's such a just empowering thing to know that for everyone listening to this podcast, like you can book an appointment with Kerri and have a consultation, which is like I never even knew that existed or that was possible.
Yeah, absolutely. We do complimentary skin assessments and consultations. And if you want a skin scan, it's a full hour. It's a mini facial with the full scan. It's $75, but then that goes toward any retail you want to purchase or a treatment you want to get. So it's awesome. Really.
It's something that I never like took time to invest in before we had met, but since meeting you, it's been such a change in my skin. And anyways, I'm your biggest fan.
You said you guys are both in your 30s. It's really the time. Like, if someone said, when should you really start paying attention? Yeah, in your 30s. Because again, that collagen is starting to decline. You are going to start noticing some effects of previous sun exposure. Other skin conditions might pop up. So it's the time to really pay attention now. But don't make skincare is not complicated. It isn't. And I know it can seem that way because there's a million products. It's a huge industry. But don't get swayed just by the fancy bottle and the new fancy ingredient or what an influencer is using. That might not be right for you. Come in and find out what's right for you. And use I'm a very simple skin therapist. I don't use a lot of different products on my own skin. I use effective product. That's where the results are.
So what I'm taking away is talk to an expert, get an
Yeah.
assessment, and then you can make a regimen together. And it might not, it's probably not going to cost you hundreds or thousands of dollars. Just get like a couple things to get started.
Yes. When you invest in skincare, again, I mentioned the hero products before. Hero products are your serums. They are what will make the most change in your skin. They are what actually will penetrate into the skin. If you only have a small budget, then spend the money there, like a high quality vitamin C, for instance, and or a growth factor type product. But yeah, that's where you want to invest, is a good quality serum.
I love that.
Yeah.
One other treatment I want to learn about before we wrap is about the peels, because I know nothing about them, and I know they're a big thing that you guys offer. What can you tell us about peels? What are they? What do they do? Why do we need them?
So peels are basically exfoliation treatments. So they're exfoliating your skin. They range in everything from mild peels, such as an enzyme. I'm going to talk about these as if coming into a clinic and having a service, not anything you use at home. So enzyme peels are very, very gentle. So if you have more sensitive skin or someone with rosacea, enzyme peels are great because they'll only remove dead skin. So you're not going to over peel or cause any sensitivity. Then you have your glycolics, your salicylics, your Jessners. They get more intense depending on what we're trying to treat and how quickly you want to get there.
Okay.
So a Jessner, for instance, we call that a skin lifting peel. It actually will penetrate the surface of the skin, wound that area, and then that skin peels off and new skin underneath. We could do that. You'd have a week of downtime, or we could do 6 lighter peels and get to the same place. Okay. If you don't want the downtime. So it really, again, that's when I mentioned lifestyle, but peels are basically professional exfoliation treatments.
Oh, crazy. Okay, so the downtime varies with those. I didn't know that.
They do.
I'm learning so much right now.
Last time I had a peel, I thought I was going to have
the lift didn't lift.
Well, no, it did, but it wasn't as scary as I thought. You kind of had to look, and I was more self-conscious, but I don't think people looked at me and thought, remember the episode of Sex and the City?
That's what I was just thinking.
That had a treatment. She was terrifying looking.
She had what I believe, and because I watched that whole series, she had what's called a TCA peel, or trichloroacetic acid, which it's one of my favorite ones, but Health Canada pulled it years ago. It's not available in Canada.
Okay.
And that's what caused that, because it was strong.
Right.
And in the right hands, it was amazing. I could take 10 years off your eyes just with a TCA peel easily.
Well, someday we're going south to the United States.
Yes, they still have it. One thing I wanted to ask you though, did you prep your skin prior to that peel? Did you use retinol?
No.
How do we prep our skin? Okay, so the vitamin C you mentioned before, but retinol is another one.
If you want a good lift from a Jessner, I won't do it until you've been on retinol for at least, I like a whole month. But retinol is the other hero ingredient. There's the 2 that I love, vitamin C and retinol, for the most anti-aging benefits and to keep the skin very rejuvenated. And your sunscreen, that's number 1.
Don't worry, Kerri, I'm never getting rid of the sunscreen.
But had you prepped with retinol, then you would have lifted more.
Okay. All right.
Oh, these are fabulous tips. I love this so much. One other question I have for you, Kerri, is seasonality. Are we able to do all of these different treatments we've talked about all year round, or some? I
mean, there are places, let's just say if we were in Arizona, yes, we'd be doing all these, but we have the 4 seasons. So I particularly, and I know my colleague Tanya, who does laser as well, the time for photorejuvenation is November to early spring. Let's get it out, because we have such a short summer month, and you do have to be careful. You don't want to be getting a series of photorejuve in the summer, because we're going to tell you to just stay out of the sun completely. Wear your sunscreen, absolutely, but it's just better in the colder months.
Okay.
For the way that I'm comfortable doing it. Yeah.
Okay. And is that the only one where we need to think about time of year?
In the winter time, it's crucial to come in for hydrating treatments as well. Not all treatments need to have downtime. A big part of my clinical business is just maintaining the health of the skin. So we have something called intraceuticals, which is a very beautiful hyaluronic acid, low molecular weight, just penetrate that serum into the skin. We do it after dermaplaning directly. it's like we just poured like gallons of water into your face.
That's the one
It's
that like blows
amazing.
liquid on you.
Oh yeah.
Okay, I could never remember what it was called. I've had that done.
Intraceuticals.
It's the best treatment.
It's called our red carpet treatment because it's very
Madonna.
big in Hollywood. This treatment is used prior to makeup applications for a lot of stars when they walk the red carpet.
Your skin
is amazing.
Glowing.
Yeah. It's our red carpet treatment, so it's great before special events. But if you just feel parched and quenched and your skin's just feeling it, Dermaplane and Intraceuticals, there's nothing like it.
Oh my God. I love
You're
this.
like shiny. I can never remember. I always want to call it like Hydra facial.
Yeah, it's similar to
Okay.
that. It also like maximum benefit about 12 hours later, because this hyaluronic acid can hold its weight in water like 2,000 times. So once this acid, it's a natural constituent in our skin, but we're so depleted because of the cold weather, the heat, artificial heat, drinking coffee, drinking wine, like everything we do tends to dehydrate us. So this is just going to put that moisture back in. If you're someone who's chronically dehydrated, I'm going to get you to come in a few times, like in a row, like a couple times a week for maybe 3 weeks, just to get you really back to that natural, like that great hydrated state. But yeah, it's amazing. And no downtime, like literally zero.
Well, if you were to put your makeup on or go anywhere after, you'd be like,
But what it's saying, so 12 hours later is the maximum benefit. So it'll continue to plump in the skin.
So if you're getting married, maybe a day before you have this.
Exactly. Yeah. Yeah.
Ooh, baby.
We do a lot for brides. And touching on getting married, like come and see if you have concerns, if you're getting married about 8 months before your wedding, you should really start consulting with a skin therapist and get you on a program, figuring out all those things that you want to do or need to do.
This is a great time for people prepping for spring and summer to get into.
Yes, absolutely. Yeah.
Oh my gosh. Are there any other treatments that you'd like to share with us or that we should know about?
Trying to think. I mean, as far as skin treatments, I think we touched on the major ones that I certainly love doing.
Yeah.
There's another one though I want to touch on, and it's radio wave frequency. So RF treatments to tighten the skin. It's another modality to produce collagen. Okay.
Ooh.
So, but this one has zero downtime. So where we have microneedling, you are going to have some downtime, but we have a treatment called Thermi. You've probably also heard of Thermage. So those treatments basically use radio wave frequency or RF energy, deep heat, to stimulate the cell that produces collagen, and you leave with like zero downtime. That's something that we do a lot of as well, because again, it's we're losing collagen. We need to stimulate it constantly because our bodies just over time just doesn't produce it anymore and we lose it. By the age of 60,
oh God,
you've almost lost half of the collagen you had when you were 20.
You know what? We're all doing the right things.
Yes, you are.
And even for people that are hearing this and might be over 40, 50, 60, like, though you said it might be a bit harder.
It's never too late to address. No. And what I meant by that is it just might require more intensive treatments or working together a bit longer to get you where you need to be.
Yes.
But nothing is like,
and nothing's not treatable to some respect.
Right. I mean, if it's in, let's say acne, if it's too severe, I'm going to recommend you to see a physician. I can't treat that on my own. If it's sun damage, we're at the point of I'm thinking there's what's called actinic keratoses or precancerous lesions. I'm going to get a doctor involved. But those are things that I can recognize.
Right.
But if you're a healthy person and your skin is just really showing signs of aging or other concerns, I can absolutely work with you. But the number one thing is you have to have patience. I find in society today we are impatient and we want like now, like Amazon. We order it. Oh, it's on my doorstep tomorrow. It doesn't work that way with the skin. So have patience. Work with somebody. Follow their recommendations. I don't really enjoy if someone wants to see me for treatment, but they won't take my recommendations for proper home care. You just won't get the best outcome.
Right.
It's the truth. So it's not a sales talk. It's just like, without this, we're not going to get you there because you're doing that every day at home. That's crucial.
That's the biggest part of your skincare.
It is.
I can't wait to wash my face tonight.
Oh my God.
Already.
I mean, and I said it before, like I've learned so much from you. So every time you're here, it's just like my mind is expanding and I'm so excited. I'm so excited.
Next week will be fun.
I know.
Yeah.
I'm so excited to get to do the Photorejuve. Oh my gosh.
It's going to be great.
That's going to be awesome.
Yes.
Thank you so much. And don't think that we're letting you leave without playing.
Also, before,
yes,
one thing, Kerri, we ask all of our guests, what is lighting you up right now? What are you excited about?
Well, I'm actually teaching a course this weekend, a clinical course to train some estheticians and grow their knowledge base and expand their career. So that always lights me up. I love sharing my knowledge and training, newer estheticians to give them the skills to develop into more of a skincare career. So that's what's lighting me up right now.
Love that.
Oh, I love that so
good.
much. All right, Ash, it's now time.
It's time. You've played this before.
I have, I think.
Queenie Grams.
Yes.
It was Westy Grams early 2020. Now it's Queenie Grams.
Now it's Queenie Grams.
So can you pick a number between 1 and 99?
1 and 99. We'll all go around.
Okay. I'm going to pick 97.
Ooh. I love the exact same reaction.
My son's birth year. I'll pick that.
Aww. Okay. If you had to eat one thing for the rest of your life, what would it be?
Oh my. One thing for the rest of my life. That's a tough one.
What's your favorite?
I do have many favorites. This is going to sound, I don't eat them very often.
But if you could.
Oh, I love a good chicken finger.
Oh.
Like, no, a good, not like the ones out of the box. I mean, like a real good one.
Yeah.
Oh,
like
yeah.
a nice, real breaded, like.
Yeah. I do. I love those.
Ooh, I do too.
I like
We're
that.
going for burgers after, so this is going to be
You're getting us ready for this. Ashley,
can you pick one for me? I want a new one.
All right, here we go. Number 85. What food can't you stand?
Anchovies.
What?
Yeah.
I've fed you anchovies.
No, but you know what? I'm not going to say the restaurant. It's a restaurant I eat at in Halifax quite often, and there's a salad that I love, but for a while I couldn't figure out. It was on the salad, but not in like a paste.
It's not like a Caesar.
It was like broken up like pieces.
Okay.
And I couldn't put my finger on why
I don't like that.
No, I think it was a combination with in the salad. Mm-mm. So I just had this experience the other day, so that's just fresh in my mind.
Okay. Okay, I'm open to that. But the time I fed you an anchovy pasta.
That's fine.
Okay, you were okay with that.
Not with salad. Unless it's in Caesar salad.
Mine was like crushed up. You couldn't tell. Is there any food that you don't like, Kerri?
Oh gosh, I'm really not a picky eater, but liver. I don't eat a lot of. Yeah, I'm weird with meat.
I'm like that too. I like meat a lot, but I don't eat the things that I like the regular.
Me too.
Chicken.
Yeah, I know. I'm the same. I love seafood. Yeah.
I'm into it all. Although I've never had liver, to be honest.
I can't do it.
Yeah, I don't think I really want it.
Just the sound of it.
All right, I'm gonna go. Number 80? What have you recently formed an opinion about? Here's an opinion.
This is a loaded question.
No, here's an opinion. My finger is shaking. Like this is gonna be bad. That I recently formed is that I know nothing, and no, all of my opinions are wrong. Is really truly what I've formed an opinion about. Is like the things that in my
Mark, remember this. Producer.
But
Mark.
the things that I have opinions about are often stuff I don't know that much about. And what I've come to learn is that once I get to know things, and I think I get this from the podcast, is we talk to people about stuff we don't know, my mind has always changed.
Yeah.
And so that is my new opinion, is that my opinions are almost always wrong.
Mm-hmm. I don't know if anyone's opinion can be wrong. I think that you're not just stuck to it. Like you're an open-minded person, so you're able to see at different sides of things.
Yeah. But this has been a new revelation for me, is that anytime I feel like resistant or I'm like, oh, I don't like that, I'm like, I should maybe learn about this because I might be open to it.
Yeah,
I think that's good for you.
Yeah.
Yeah. So that was what I've recently formed an opinion about. Have you recently formed any opinions, Kerri?
I try not to be political at all. Like, oh my goodness. I think in with what we're dealing with in life right now, opinion is, I do believe in wearing the mask, and some people don't. So that's something I've been very opinionated about. But other than that, I really try hard just to keep my opinions to myself mostly.
My mom, she lives by this rule and has always told me, she's like, don't give your opinion unless someone asks.
Exactly. So you asked, so I gave you one, but I don't jump into the middle of anything. It never turns out well.
Because I know some people that are very opinionated, and sometimes it's like jarring.
It's
because you're like, but I
overbearing.
didn't even care. I'm not gonna say the names. It's not you. Don't.
Oh, I thought it was me.
I know what to expect.
If it's in the context of go out to dinner and a
Yes.
good conversation, that's different. But yeah, you have to
It
be
can rub
careful.
you the wrong way. Like if someone just walks through
It
the
can.
studio and is like, oh, I don't like, oh, why would you? Just people like have this verbal opinion diarrhea. Not into it. All right, we just went on a rant.
No, I know.
Do you have any opinions you've recently formed while we're just closing this circle?
I don't have any opinions,
Right.
mostly. No.
well, we'll end on
I'm
that.
with Kerri on the
note.
mask. That we hate them, but like we understand.
Don't love them, but I understand.
Yeah.
That's
All right.
awesome. Kerri, thank you.
Thank
This
you
has
guys.
been so fun, and I can't wait for next week.
Yeah. So that's gonna be taped, so everyone will get to
They'll
see
get
your
to watch it.
treatments. Awesome.
Make sure to check out our YouTube channel at Rival and Queen, and also Instagram, and we'll be sharing lots on there.
We'll be sharing the experience and then also what has happened, like the after effect of it.
Oh,
so
amazing. Yes.
you guys are gonna get to see the full thing, which we're so excited, and thank you for doing that. Kerri, where can people find you?
So I'm in Bedford. It's
Yeah.
called Vibe Salon Medi-Spa. It's a great team, and we've got a lot of wonderful experienced skin therapists. So I'm there every week. Yeah.
I love that. And we'll tag Vibe, the website and your Instagram. What's the Instagram?
You know what? My Instagram is really lame. You can tag it. I'm the worst for putting content online.
That's okay.
I just am. But I do have one, and it is there. I usually put a lot more content on our work account.
Okay.
But you can tag mine too. But just people might scroll and be like, oh, she's got 9 pictures.
But they can follow the Vibe Instagram account as
Yes,
well.
I do more with that.
I love that. So we'll tag those in the show notes for you guys as well, and you can follow along.
Thank you.
Excellent. Thanks,
so much,
guys.
Raquel.